I'm Michael Battelle, president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. I am very excited to introduce Dr. Jonathan Stine, who's a hepatologist and associate professor of medicine and public health sciences and research director at Penn State Health Liver Center. Dr. Stine's an internationally recognized liver expert with research and clinical focus on metabolic dysfunction associated steatotic liver disease, otherwise known as MASLD, which is much easier to say. Today, in part 4 of our 10-part special series, Liver Insights 2, for patients who have already been diagnosed with MASLD or MASH, we'll be discussing lifestyle modifications that make a difference. Dr. Stine, you're a well-recognized expert and leader in MASLD and MASH, and your focus is always about lifestyle enhancements and care. What are some realistic goals, and can you share some small steps that can be integrated into daily life without patients feeling overwhelmed and being afraid of everything that's ahead?
Yeah, absolutely. And first of all, thank you so much for having me, back again. It's absolutely a delight to, chat with you, Michael, and everybody, at Fatty Liver Alliance. And, anytime we get a platform to talk about healthy lifestyle, please, I'm all yours. So,
Perfect.
for me, I mean, with years of experience, it's really disheartening to see the frustration that our patients exhibit every day, right? Everybody knows that, eating healthy foods and being active is good. And, most, physicians, at least here in the United States, do a very poor job, in my opinion, in terms of educating patients on healthy lifestyles. And it's generic advice. It's kind of a one size fits all approach. It doesn't take into account, what the patient is living with and dealing with every day. Whether it's somebody who's recently retired and has more time on their hands, that's a very different individual to create a lifestyle prescription for, compared to a young mother who has, 4 children and is working a full-time job, right? You're going to do very different, things to make sure that we're trying our best to make healthy choices. And I think as physicians, we need to reframe how we approach this and, recognize that patients are trying their best, right? Nobody wants to be unhealthy, right? If you talk to our individuals living with MASLD, over 90%, have a desire to make healthier choices. And then when you sit down and say, well, that's great, why aren't you doing this? There are barriers that have, come out on work we've done and work of others. And it's folks, just they don't know how to do things, whether it's they don't know how to start an exercise program or they don't know how to, shop for the healthiest food options on a limited budget. Or there are many other constraints. So, I hope, through today's, time together, maybe we can share some simple, solutions, some steps, some sound bites, if you will, things to help kind of motivate and things that I share with my patients. So if it's okay with you, can
Yeah,
I just,
let's,
share a couple
of
slides today? Would that
course,
be all right?
let's start with that. Yeah.
Yeah, try to be prepared. So let me see if I can make this happen here. All right. Let's see. You see the big
Okay,
slides?
perfect.
Sounds great. All right. So again, Michael invited me to talk a little bit about lifestyle modifications that make a difference. But before we talk about this, the question is, why is making some of these changes in our daily lifestyle important? And one, when we focus just on individuals living with abnormal metabolism and steatotic liver disease, there are many benefits with making healthy choices. First and foremost, it plays a role in primary prevention, so meaning it can prevent you from developing the disease. And I do realize that many folks here, listening today, have already been diagnosed, and that's what our intended audience is. But by chance, if you are earlier, by leading a healthy lifestyle, you can actually even prevent needing some of the advice and the wonderful therapeutics that are now available. And for example, for every 2,500 steps that you take each day that is additional to what you usually do, the risk of developing MASLD decreases by about 20%. And, when you complete this amount of physical activity and then you sit less than 3 hours a day, you can reduce your risk even more down to about 30%. So, it's really helpful to make sure you don't develop this disease, you modify your risk factors, and then leading a healthy lifestyle decreases your need for medications, right? Which allows patients to feel more empowered, right? You're taking charge of your life. You're saying, hey, I want to be healthier. and then you feel good, and then you get more buy-in, and you want to, make even more healthier choices. And in the long run, this is going to be more cost effective. And then healthy lifestyle is a much more comprehensive approach than a medication or a combination medication, where the medicines are very good, only target one or two or maybe three abnormal pathways in your liver. And this is a very complex disease where many different pathways are implicated. And luckily, when you make healthy lifestyle choices, you actually impact a lot of them and simultaneously. So, I've said healthy choices, so many times. What exactly is a healthy liver lifestyle? So, first and foremost, it's going to be consuming a balanced diet, right? We talk a lot about Mediterranean informed choices. You may say, John, well, what exactly is that, right? So it's consuming plenty of fruits, vegetables, whole grains, lean proteins. Each of these is very essential for liver health. And foods, such as broccoli or spinach and berries, are very rich in antioxidant and nutrients, which help support, some of the things the liver does, including detoxification. Now, on the other side of the coin, we want to avoid foods that are high in added sugars, saturated fats, processed ingredients. So everything that is bright and colorful at your local supermarket that comes in a box bag or can, because this can really increase fat in the liver and lead to damage over time. We also want to stay active. We'll talk about, physical activity, because that's a lot of what I focus on with my research and my expertise, and go over some, simple steps and things you can do to get more active. And again, remember, for every additional 2,500 steps you take each day, your risk of MASLD goes down by 20%. Michael, have you had your coffee today?
Yes, I did. I had two.
You did. Okay, good, good. I've only had 2 cups, so I have to get to 3 if I want to get maximal benefit. And we know 3 cups at
Three
least of
cups.
black coffee, which is what the research did. Yeah, yeah. Eight
What's a
ounces what the
cup?
studies did. But if you go more, you're not going to hurt yourself. Diminishing returns maybe a little bit, but it's not going to cause problems. Okay, and that's because coffee contains many compounds that reduce inflammation. They may help prevent liver scarring or fibrosis. These compounds have fancy names like polyphenols. And again, if you have a tiny little bit of sugar or cream, it's probably not going to hurt things, but black coffee is going to give you the most benefit. And if you get to Michael's threshold, at least 3 cups a day, you're going to do well. Avoiding excess alcohol is also important, right? We know alcohol is one of the leading causes of liver damage. Excess alcohol typically is defined as at least, more than 1 drink per day if you're a biological female, or more than 2 drinks per day if you're a biological male. But if you have any scarring or fibrosis in your liver, especially stage 2 or greater, it's best to avoid alcohol completely, because it's like gas on an open flame.
So wait, before you go
The
to the
last part of a healthy lifestyle is quit. Oh, go ahead. Sure.
so
Yeah.
before you go to the next slide, I just want to ask you about that. So sorry to interrupt you.
Uh-huh.
It was very interesting. So
You're good.
if you have a glass of alcohol, like you said, and you have something that is ultra processed or high in sugar, is it like a double whammy because the liver is already impaired from the alcohol? I've kind of always wondered that.
Yeah, absolutely. There's really nice data out of University of California, San Diego. Viraj Mehra and his team have looked at even small amounts of alcohol when you have steatotic liver disease from abnormal metabolism. And if you have stage 2 scarring greater, even small amounts is harmful. So the liver is already inflamed; it's already primed for insult. So again, when you add this, it's really gas on the open flame. Fibrosis disease, progression is going to follow, and go much more rapidly, even with small amounts of alcohol. All right, and then the other part too, we all know smoking is unhealthy, right? And this can introduce toxins into the liver. And we're just learning more and more about some of the environmental factors. So quitting smoking can definitely improve liver health, but also reduces your risk of liver cancer and other chronic conditions we see more commonly. Now, getting into some of the things that I love to study and help people with, it's going to be exercising regularly. And many of us don't like to do this. We kind of think we have to go to a gym. We think we have to go back and remember what we learned in grade school. But activities such as walking are going to be enough. They're sufficient in the amounts we'll kind of talk about. And the benefits to the liver are tremendous. You're going to reduce inflammation. You're going to lose liver fat. And you're going to reduce inflammation with fibrosis as well. And also perhaps, sometimes without body weight, improve, liver fibrosis over time. There are other benefits you're going to see outside the liver. So you're going to change your body composition, lose body fat, gain skeletal muscle. You're going to reduce your cardiovascular risk, amongst many other things, improve your bone density. And the graphic really calls out a lot of these things. But, again, I led off part of our time together saying that, a lot of folks don't know how to exercise. And actually, US medical schools spend 0 minutes educating doctors on how to deliver an exercise prescription. So, while we work on that as a medical society, at least our group is trying to change this narrative, provide resources. So we've developed an exercise prescription pad that's very easy to use. And it's shown here is something that we help other clinicians, provide, but it's a simple exercise routine that is progressive. So, one mistake people, make when they're trying to become more active is they want to go couch the 5K in a day, right? They come in, they get motivated, they're excited, and they try to make, humongous changes overnight. And we're all creatures of habit, right? We're working on 20, 30, 40 plus years of behaviors which are perhaps less healthy. And if we want to make, lasting change, it's small little tweaks and small little progressions. So, shown here is just an example of a typical exercise, program where we provide people the first, 4 weeks a recommended guidance. And by the end of the 4 weeks, we've really got them to what our guidelines say people should be doing, which is 150 minutes per week of moderate intensity activity. And you may say, well, what is that? It's really activities such as walking or light cycling. And, Michael, have you heard about the Sing talk test at all?
If you can, yes, if you're on something like a treadmill and you can talk, that's one thing, but you shouldn't be able to sing. Is that it? Am I
Correct. So
close?
that tells you that you're doing, yep, you're absolutely 100% correct. Awesome. You're well coached and walking the walk. But, this lets us know that you're at the right intensity. So you're at that moderate intensity, which is really what we're targeting to get the maximal benefit for liver health when you're living with MASLD. So, when we start people at a moderate intensity, we're going to start at a fewer, sessions, per week. In the beginning, we start people at 2 sessions for about 20 minutes. And then you can see here as the circles move across, there's a progression to where we get people to, 5 sessions a week at that moderate intensity where they can talk, but not sing, through walking. Now, the other thing is resistance training is important. Again, you don't have to go to a gym. Even if Planet Fitness is only $10 a month, which is super cheap, you can just, do things at home. And there are low impact exercises, right? We have patients who, are saying, I haven't done any exercise for 10 years, for 15 years. I'm so afraid of getting hurt. And if I get hurt, then I'm not going to stick with it. And that makes sense, right? So we have some ideas, some programs which can help kind of with that fear of injury. And showing here are just some examples of activities that people can do as part of resistance training that are body weight based. They're going to strengthen your muscles, and the chance of getting some sort of musculoskeletal injury, at least with these six simple exercises, is pretty low. And ultimately, you're going to want to do something like this 2 days a week. The format is provided for you here on the webinar and listed below in terms of how many repetitions you're going to do for each exercise, and then also how long to rest in between. And, if you ever need some motivation, we've developed some motivational, statements here, so again, we've talked about this multiple times, an extra 2,500 steps a day cuts your risk of MASLD. And, some studies suggest that nearly it can go as high as 50%. And then also 20 minutes of walking a day reduces MASLD risk by 20%. And this is my favorite stat I tell patients, number 3 here. So if you improve your fitness by 10%, your chance of dying is 15% lower. And people just do this. They're like, what? I mean, that seems like a very, very small gain. And it really is. Exercise is a panacea. It is a wonderful treatment. And we all want to be here on planet Earth, right? Why? Well, we all enjoy what we do. So why would we not make small steps here with very small fitness gains to improve our chances of being around for the things you want to be around for? Item 4 is also really important. Doctors often focus on weight loss, weight loss, weight loss. I'm sure the individuals who are living, with MASLD, listening today have heard this, ad nauseum. But, if you get active, you don't have to lose any weight, and you can still see a lot of these benefits. And then lastly, we also talk to our patients about exercise snacks, if you will. And, this is really just, for people who are time crunched. And, not everybody has, blocks of 30 minutes. Again, think back to the the busy young mother with multiple children who's working full time, right? She may have 10 minutes before, work or getting, kids on the bus, 10 minutes, over lunchtime and 10 minutes when she gets home. And so long as the activity is moderate intensity, so again, being able to talk but not sing, to whoever is there supporting her, this counts. And you can ultimately add this time up to get to the intended amount of activity we want to deliver to improve the liver. And if this isn't enough, for you and you need more motivation, we live in a technological world. There are so many different tools available, whether you want to get a wearable device, to track your steps every day or track your heart rate variability, to smartphone-based applications. We've done some research in this field. I have no ties to Noom on any proprietary, way, but we did use this application to help our patients lose weight and become more physically active. They increased their step counts by at least 35%. Just with a simple application that taught people, how to be more active and what choices to make. So, really, there are many tools that are available. It's very small changes. It's remembering these sound bites, the little things that motivate us. And then remember that it's going to take some time and we have to progress and we have to start with very small changes and manageable goals. If we go out and we really look at the finish line and say, I want to be there immediately, you're not going to get there. I hate to tell you, but again, it takes time, it takes buy-in, and it takes finding what is individualized and personalized for you. And you're going to have to try different things. You may say, well, John, 4 of the things you said to me don't work. But when I remember that if I just improve my fitness by 10%, my chance of dying goes down by 15%. That really motivates me. You have to find what works. And, if you're looking for more tips and tools, you can follow me on social media. Michael can put you in touch with me. And, we're always happy to help people, lead the life they want to live and make healthier choices. So we can put the brakes on steatotic liver disease or even get back to a healthier, happier liver and then a healthier, happier you.
Yeah, that was perfect, and thank you for sharing all that. I had a question as you were speaking about a 10% improvement in fitness. What is that exactly? How would you measure that?
Yeah, so in the research lab, we do that with formal treadmill testing, where people get on a treadmill, they wear a mask, and we measure their actual fitness based on gas exchange and how long they can stay on the treadmill to get their heart rate at goal. If you want to extrapolate that, you can look at wearable technology. Smartwatches, can approximate, your VO2 peak, which is a measure of fitness, and just from there, you're going to look at what your gains are. So, most people living with MASLD have a cardiopulmonary fitness about 20 milliliters per kg per minute. If you had to just pick a number that is pretty reasonable, so we're looking at a very small gain of only 2 milliliters per kg per minute. But if you want to just, pick another metric, you can say, all right, well, I typically walk, 5,000 steps, a day. So if I want to increase, my fitness based on step count, 10%, I have to walk another 500 steps. So it's really little things here. We can pick different things. In the research lab, it's very different than what we try to do on a daily basis to make sure we are working on our fitness.
Yeah, I was trying to think of people who maybe don't have that luxury of going to a state-of-the-art lab and just thinking, so using an output measure of some kind, so either the length of time people are exercising or the amount that people are exercising, like you said, the steps. If you go 10%, you could extrapolate and say that might be a 10% improvement in fitness, or you're on the right track anyway, right?
Yeah, I mean, it's certainly not a perfect measure, and there's definitely some assumptions and leaps of faith there. But I think if you give people a target and somewhere to reach for, I think that is more important than the exact correlation between step count and fitness. So again, if you want to be as scientific as possible without going to a research lab, get a wearable that measures or approximates your cardiorespiratory fitness. But if you want to do some crude measures, it could even just be duration of activity. If you typically walk 15 minutes a day or 20 minutes a day, let's make it easier. Try to walk 22 and get to that point and say I've done 10% more. And perhaps if you measured your fitness, it would be close to 10% greater. So it's all about motivation and how you spin the conversation.
I'm definitely one of those data junkies before I go for my hour walk every day. I reset my Aura ring. Let's say they got the ring, and so that measures quite a lot of things. And I have the Apple Watch, and I still have the phone with me too. So all three of them are sort of working together, and it gives you like this summary, almost too much information. Sometimes, but I really like it because it shows, it was, that was really a light walk, not even a moderate walk. So I probably should have tried to walk a little faster, little things like that, I think. And, as we have discussed before, the VO2, I need to work on that as
Mhm.
well. So probably everybody has something that they can try to do better. But
Yeah, and then there's other markers of fitness, right? There's resting heart rate, which is
yeah,
affected by other things like sleep quality and caffeine. But, I mean, if you look at it the same time every day and you look at your trends over time, if you see, 10% improvement in resting heart rate, it does that approximate your fitness? It's probably
yeah.
close. So
I,
again, I
I
think there
want
are simple, things we can do.
I want to revisit a question I asked you during your presentation, just so that I understand it.
Mhm.
It wasn't so much about alcohol being good or bad, especially with liver
Mhm.
disease. With liver disease, really, you should have zero alcohol. I was thinking that maybe people that are still early on, as almost half the population is now, and have just fatty liver disease, MASLD. If you're going out for dinner and you choose to have, you're going to be having a dessert, let's say, and that's bad, but we got to live life, right? Are you doing a double whammy by having a glass of wine also? Like, should it be a choice to say, okay, if I'm going to have dessert, I'm not going to have a drink? Because if you have the drink, does it make it like almost twice as bad because the liver's busy, really, as you said, being impaired even uh, with this toxic agent, right? The alcohol.
Yeah, I'm not sure I know the answer to
Yeah.
that question. I mean, I think I just would say anything in moderation is a reasonable choice. So if you're going to have both a glass of wine and a dessert, I love cheesecake. So
Yeah.
maybe I'll have half the glass of wine and half the cheesecake, and perhaps it's a little bit of a healthier
Yeah.
choice. Certainly if you do this occasionally and it's not a daily occurrence or a weekly occurrence. I think again, you have to live your life. You have to enjoy food, and you can only restrict for so long before we're creatures of habit, and then we go and we binge and we undo all those unhealthy choices.
No, for
So
sure.
being realistic, and then the next day just being like, hey, all right, I didn't do a great job
Yeah.
yesterday. I know I didn't. Today, I'm just going to make some healthier choices.
Hey, let's end also by honoring Stephen Harrison and say his famous quote that you can't out exercise the fork. So no matter how much you exercise, if you're having the cheesecake that you love so much, what kind of cheesecake do you love?
Oh, any, turtle, cannoli. I mean, it was so for New Year's or for Christmas this season. My wife got a nice spread from one of the local bakeries where we had five different types of cheesecake. I think key lime was on there. There's one with cranberry compote, so
Okay, so
it was
how many
delicious.
steps do you have to take to do that, to cover that? A lot.
It was probably about 500 calories per piece, so that's probably about 40 minutes for me on the Peloton later today to
Oh, there
undo
you go.
that.
Yeah,
So that's a
Peloton.
lot. That's a lot of work. I might have
Yeah.
to not be able to sing or talk to get there to get the intensity that I
Thank
need
you.
to burn
Thank you.
off the cheesecake.
Thank you so much as always. I love talking with you and sharing with others. So thank you so much.
Yep. Thanks again for having me, Michael.